Hello, and welcome to the complete question and answer audio series, Problem Solving for Nursing and NCLEX RN Exams. This is tape 2 in the psychiatric series. My name is Laura McQueen. I'm a nurse educator, consultant, and a clinical specialist in adult psychiatric and mental health nursing. This tape is published by Meds Incorporated of Silver Spring, Maryland. In this audio presentation, I will highlight some important concepts related to mood disorders, chemical dependence and abuse, organic mental disorders, eating disorders, family violence, rape, and legal aspects of psychiatric nursing. I will then review test questions from your complete Q&A book, followed by a discussion of each question. I will begin by reviewing test questions and answers related to mood disorders. This will include bipolar, depression, suicide, electroconvulsant therapy, ECT, and medications used to treat the mood disorders. The first topic I'll cover will be bipolar disorder. Clients with a bipolar disorder can suffer with periods of severe depression and/or mania. The client with an elevated mood will experience a great amount of activity. The nurse will need to provide for the physical and safety needs of the client during the extreme manic portion of the illness, as the client will appear too busy to do so. When working with a depressed individual, the nurse will have to provide for the physical needs of the client, such as eating and motor activities. The client will appear immobilized and may not eat. The depressed client will convey feelings of helplessness and hopelessness. In the next portion of the audio tape, we will look at two questions related to bipolar disorders, mania and depression. The first question comes from the book, Test 9, number 81, which reads, a manic client tells the nurse that his latest computer project is revolutionizing the industry. He also states IBM and Apple are both going under because their products cannot compete with mine. In choosing how to respond, the nurse is best guided by the knowledge that 1. This statement is grandiose and does not require a response. 2. This statement represents the client's inability to deal with inner feelings of inadequacy and vulnerability. 3. Manic clients are prone to exaggerate the facts of a situation. Or 4. This is a delusional statement that should be confronted to correct the client's perception of reality. The answer is number 2. This statement represents the client's inability to deal with inner feelings of inadequacy and vulnerability. This question was pretty difficult. I'm sure you can picture the manic client with the pressured speech and bizarre stories about their sexual exploits. It is important to remember that elated mood and grandiose statements of manic clients reflect their inner feelings of inadequacy and vulnerability. Although number 3 is a correct response, that the client is prone to exaggerate facts, it does not guide the nurse in choosing how to respond. The nurse's response should focus on underlying themes and feelings instead of the content of the client's statements. A good test-taking tip is to select responses that deal with or ask about feelings. The second question comes from Test 5, question number 57, and states, in planning activities for depressed clients during their early stages of hospitalization, which of the following plans is best? 1. Provide one activity a day to avoid fatigue. 2. Let the client choose an activity that's appealing. 3. Provide a structured daily program of activities for the client. Or 4. Wait until the client's mood improves and he or she indicates an interest in productive activity. Number 3 is correct. Excellent choice. Provide a structured daily program of activities for the client. At this time, the client will not be able to choose her activities. And if you